Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry public health update right here in Boulder County. We do these every week. Some things change, some things don't, but they're always an opportunity for you to ask questions. Even if they've been asked before and you need clarification, please ask them. It's better that you ask and get the information that you need than not ask them at all. In between sessions, please feel free to email. For your questions today, please put them in the Q&A. The chat is where we push out information, so it's a lot easier for us to filter if you put them in the Q&A. At this point, I'm going to welcome Jesse, and I have to tell everybody this is his last webinar with us. He's being redeployed back to his original job, but we want to thank him for, 10 months, 8
Something
months
like that,
of webinars, but thank him for helping us each week. And we'll continue having these webinars with public health, but this is Jesse's last one. So thank you, Jesse, for everything, for being a partner on these. We kind of started to, read each other's mind on these webinars. So hopefully Lane and I can get to that. Oh no, just kidding. All right. Well, and you got a big thank you on the chat already. So let's go on to Jesse to do this week's update.
Thanks, Corinne, and really thank you. I've enjoyed the time to do this, and it's been actually very helpful because I will continue to be contacting businesses as part of public health. So definitely, I will be. You'll be hearing from me again. Don't worry about it. But I appreciate everyone's cooperation and interest, and definitely appreciate Corinne and Lane keeping this moving forward and really being great partners in this. So thank you. So just, same presentation as normal. We'll start out the same. I think there's a lot of good news in the epidemiological update and the state dial status update, and then our public health order update. We've got some changes and expect more in the coming weeks. So hopefully we'll get through that quickly and get to Q&A. So the 5-day running average of new cases, we're off the peak from early in January. This is a good sign. This is what's driving our dial status. It's going to help with where we fit and what our businesses are able to do. And so this is a good sign that the community is working hard to keep the virus under control, and we hope that continues as things start to open up, as they will. In terms of the community by community look, pretty much similar in terms of proportions by community, but I think the important thing to see here again is that everyone is off their peaks certainly from November, and then that little spike in early January that may have had to do with Christmas or just the holidays, people getting together. No idea exactly what caused that, but there was that spike. So just something to be aware of there. In terms of takeaways, the big one is that our case numbers are decreasing across the board. Our long-term care cases are decreasing, which is great, especially as we increase the number of our 70 plus residents who are receiving the vaccine. That's really helping make them safe, and that's going to make our community safer in general. The two things I wanted to mention here are, while most of our age groups are down, the case trends for 0 to 9-year-olds and 18 to 22-year-olds are up slightly. And the concerning thing there is obviously the 0 to 9-year-olds are the school-age kids who are back in in-person learning in many cases. And then the 18 to 22-year-olds are the college students who are returning at CU and to other colleges across the area. So those are concerning trends. We are watching those, and I think the watchword there is to maintain awareness of all of the practices that we've been pushing from the beginning: washing your hands, covering your face, maintaining social distancing. Those are the safe ways to be out in public right now. This is just a quick vaccine update. Again, this is as of earlier this week. New numbers come out in the afternoon on Thursdays, so we're a little bit ahead of those. But I think the big thing here, 21,000 of our residents, more than 21,000 of our residents have received at least one dose, and just over 3,900 have received a full course of the vaccine. And as I said, our 70 plus population, 38.5% of that population has received the first dose. And the important thing there is the way that vaccines are being distributed. There are these phases. We're in phase 1B right now, and the governor created this dotted line in phase 1B that basically said that until our 70 plus population is inoculated, we really can't move to those people below that dotted line. And so as we progress closer and closer to full inoculation for our 70 plus population, it means that more people will have access to the vaccine. So really good news there. Unfortunately, one place where we're again seeing a problem is disparities in our Hispanic and Latinx community. While the 70 plus population for the Hispanic and Latinx community makes up 5.3% of our population, only 2.7% of that population has been vaccinated with their first shot at least. So we are having, we're going, working through our cultural brokers and through various programs to try and get more access for that community to our vaccine clinics. And that's an ongoing effort. We really want to make sure that our most vulnerable populations are vaccinated as quickly as possible. Switching gears to the dial. So right now, we're at 299.2 per 100,000 in our 2-week cumulative incidence rate. That's a great thing. While the governor put us in orange, we had lagging indicators. Our numbers were still in red at least in the 2-week cumulative incidence rate. For the last more than a week, about 10 days now, we've actually been in orange. And that's a huge plus for our dial status. But it's an even bigger thing for the 5-star program when we get to talking about that. Being in orange means that businesses that qualify would be able to operate in yellow. So that's a huge plus for all of us. As long as, again, we can keep those numbers where they are. So just because we're opening up doesn't mean we can be less vigilant about all of our safe practices. And I'm just going to keep saying that because it's the thing that keeps me up at night is we want to open up, but we really need to be careful. Our 2-week positivity rate, 3.6%. This is really great. We're in green on that, and it's down near where we were in the summer. So that's really good. We've had some pretty big spikes and maintain a high level of positivity compared to our summer low, not compared to some communities, but now we're back where I think we can feel confident that if we maintain our practices, we can be safe. And then finally, our hospitalization status. This is a bit down, interestingly enough. We were at 13 days of decreasing or stable admissions earlier this week. We're now at 12. Those trends are, hard, over a 2-week period, it's hard to really account for small changes, but it is something to watch. All right, 5-star program. I don't know, Corinne, if you want to jump in here.
Sure. So as I reported last Wednesday, we submitted our application to Colorado Department of Public Health and Environment to stand up a Boulder County 5-star program. I can't officially announce that we have been accepted, but I am expecting the Boulder County program to be approved today or tomorrow, with us being, as Jesse said, a contingent acceptance, which means that because we have metrics that have been in the orange for more than 7 days, we will be accepted to fully operate a 5-star program right here in Boulder County. Knowing that, we are working as the administrative committee. We have subgroups, and we're working with the third-party vendor, H2 Manufacturing Solutions, to be able to stand up the program as quickly as possible, with the anticipated date of opening applications late next week. Please note that Denver is opening up their applications on Tuesday using the same vendor. We're trying to only be about 2 days behind Denver, and they were accepted in early January. So we're doing everything we can to, as soon as we're accepted, to be able to open applications as quickly as possible, to get all the translations, to get all the videos, to get all the checklists, everything done, and up on the 5-Star website. I will put into the chat the 5-Star website, the 5-Star interest form, and we will be running next Friday on February 5th an information session on how to apply for 5-Star. What is 5-Star? And we'll be doing that at the 11 o'clock time slot that we would normally do these public health calls. So that's Friday the 5th at 11 o'clock, and I have a registration page. I already have my first batch of volunteers and inspectors being trained this coming week to be able to take the first round of applications. So if we have a bunch of people that apply on that first day, then we're looking to do the first set of inspections that second week in February. We're not limiting, it's first come, first serve. If your application's complete and payment is processed on the application fee, we're going to try to get those inspections out as quickly as possible. So we're going to start training inspectors next week, recruiting additional inspectors and training them on a rolling basis so that we can meet the demand that we have seen come in. If you are interested and have not filled out the interest form, I would do so. Those are going to be the businesses that I let know right away. It also helped us figure out how many inspectors we needed to train immediately, because each inspector can do 4 inspections a day if they're full-time. And I have a couple full-time inspectors, a couple part-time inspectors, and we're recruiting additional. But those will be people that are available immediately as of February 8th to do inspections if we start taking applications next week. So we're not limiting businesses. We're not limiting types of businesses. The other note I want to make is that while this is a Boulder County program, we did work through a process to allow the Weld County side of Erie businesses, so within the city limits of Erie, who are on the Weld County side, to participate in the Boulder County program. When we get our acceptance, it will include all of Erie proper, just because to create continuity between the two sides of the city or the town. So just letting you know. I think I answered the question that came in about limiting the number, but if you have additional questions, please put them in there and I'll answer them. But just know that we will have an information session. More information will come out on the 5-Star website as we have the checklists, as they're translated, as the application goes live. We'll have videos on how to do the process, videos on checking your cleaning supplies, the HVAC checklist. All of that will go live beginning of next week on the same website. So, and it'll be in English and Spanish. And if you go to the website, you'll notice we also have a Spanish side to the site. So everything will be in 2 languages.
Great. Thank you, Corinne. And that's a ton of information. Thank you so much for that. And thanks to the whole committee for doing all that work. So jumping on, so we are, again, level orange, and we've been doing this for the last 3 or 4 weeks now, and I'll just run through these pretty quickly. I think the overall message is that most sectors are at 25% capacity bar retail, both essential and non-essential retail is at 50% capacity. So manufacturing at 25% capacity or 50 people, whichever is less per room. Personal services is 25% or 25 people, whichever is less, again, per room. And then gyms are 25% or 50 people per room, whichever is less. And again, with gyms, there are no indoor sports at this point. So just being aware of that for the foreseeable future. And then restaurants, 25% or 50 people per room, whichever is less, 10 people per group outdoors, and then on-premises alcohol until 10 p.m. Indoor and outdoor events. They pretty much operate the same. Use the social distancing calculator to figure out how much space you have. My computer says my connection is unstable, so I'm going to turn my camera off for a little bit, see if that helps. The big difference for indoor and outdoor events: 25% or 50 people, whichever is less, and then for outdoor events, you get up to 75 people. For sports, I mentioned before, indoor organized sports are not permitted, and I'm going to get into some detail on that in a moment. Outdoor sports, 10 or fewer on a field, social distancing must be maintained and all participants must be masked. For sports, and I should have updated this slide a little bit, and I'll get into why in a moment, but school-sponsored sports, those that are approved Season B sports under CHASA, can begin, practices have already begun, and I believe matches will begin in February. There are a bunch of guidelines for those sports, and they include things like, if you have, for example, if a swim team is practicing at a facility, then no one else can be in that space in that facility. And the reason I wish I had updated this slide is we finally got confirmation late last week that there are particular leagues that are not school sponsored that are now going to be allowed to follow the CHASA, essentially the CHASA guidance. So the way it works is leagues, non-school sponsored leagues that have Season B sports, so ice hockey, girls swimming and diving, wrestling, I'm blanking on a number of others, basketball, those sports, if they are in an approved league and the approval comes from the state, then they can begin to practice in facilities now as well. And they follow similar guidance to the CHASA program. They have to follow the same outbreak guidance. There are a number of other caveats that are all set up by the state in cooperation with the particular league. And so we're still working out all the details on that. If you are a league or you are a facility that hosts leagues that are Season B sports, you can contact us and we can try and help you out, figure out what needs to be done there. But really it is an agreement between the league and the state. We are not involved in the processing of that. Switching gears pretty much totally. Small business grant program, it ends very soon. I believe the 29th at 5 p.m. is the close for that. So again, restaurants, bars, caterers, movie theaters, and gyms. And yeah, it's 5 p.m. tomorrow is the last day for that. You can click on, or you can go to that link. Corinne's been providing it in her emails. Just an opportunity there for some additional funds through the state. And then want to encourage everyone to join the exposure notification system. Corinne has mentioned it before, and I'll mention it now. Promoting this exposure notification system is one of the things you need to do to obtain that 5-star certification. So, joining it is one step. Promoting it at your facility is just as important. We want more people on that. The more people who are part of it, the more effective it is in the long run. Our business sessions will continue even in my absence. I don't know how you'll all do it, but I'm sure you'll soldier on. Thursdays, 1 p.m. And then we'll have Friday sessions as needed. And our Spanish language session, really worthwhile checking in on. It gets recorded in advance, but it is released on Thursdays. And we really want to continue having that available. And with that, please contact us if you have questions or call the call center if you have complaints, and happy to take questions.
I'm going to answer one real quick, and that question is, do posters exist already for notification to customers to sign up for the exposure notification system? And the answer is yes. If you go to the 5-Star website, it says how to prepare, and one of those things is exposure notification system, and there's English and Spanish toolkit. And those are going to be posters in English and Spanish that promote the exposure notification system. So those are already available for you on the website for 5-Star. And in both languages. A lot of the posters that you need are available. There are a few more that we need to create, and those will be created next week and put into our regular poster toolkit that we have that is also linked to on that web page. And then the question about further guide, there's a question about vaccination, Jesse, and that is there further guidance on what frontline essential worker under phase 1B below the line means?
There is not, as far as I know. I've been asking the state and our vaccine program, and I actually just put it in the chat, and I think I did it right this time, Corinne. I put the link to the Colorado helpline, which is set up by CDPHE. You can call that number, and they will apparently. This is my understanding from our vaccine team. They have a lot more information on who qualifies and how to qualify, as well as any information about future programs that might change. I know we've gotten questions about can the county or the state do a vaccination drive at a particular business, and I want to, I guess I don't know the answer to that in the future, but right now, and I did not include this in my conversation in the slide, but we are under very constrained vaccine supply situation. We've had this week and last week, we had fewer vaccine doses delivered across the state, and significantly fewer. So we're really trying to get as much vaccine out as possible to everyone, but we are constrained across the board. But to answer the question again, contact that Colorado helpline, and they might help you define what is a frontline worker. It may be just some subset of your workforce that can that would fit under that definition.
And the other link that I put in the chat, I thought this was actually, they've had before just the prioritization, but now on the state site, they now have a flow chart that says, are you this? Yes, and it goes here. No, goes here. Yes, goes here. And it even says that, under the dotted line won't even start till March 1st. But they have this new flow chart on there, which I thought was a helpful tool, and I've been sending it out just to give people an idea and a framework to how to think about where you fall. I've also gotten a lot of questions about, I'm in kind of a middle category. I educate kids. Can I fit into the category of educator? And your response to that would be to probably call this co-helpline as well, correct?
Yep. The other way to do, I mean, if you're an individual who's an educator, if you're part of a larger organization, contacting the human resources team at your organization, I know just from interacting with businesses that a lot of HR teams are doing a lot of outreach right now to try and, again, do exactly as we're doing here, get information out to their employees. And so hopefully, if you are an educator in a larger organization, if you are not part of a larger organization, I definitely recommend calling the Colorado helpline.
And then if you're a category, we've talked about massage therapists and some of those other categories where you're not sure, you might want to check with your industry associations or your licensing authorities, because they may be working on helping to clarify where, some of those uncertain categories fit in more on a collective basis as opposed to one business at a time. So that's the other advice I'm giving to businesses is in those it might be easier for an entire industry to get that answer than it is for an individual business.
Absolutely.
Will there be an announcement about vaccines being available at the fairgrounds? Someone said they've heard that this was a plan.
I'm not aware of that. What will likely happen again, we're in a situation where we're still above that dotted line in 1B, and so what's happening is people are being contacted individually as the supply uh, appears to be available to vaccinate them. So if you have signed up and you are in a category that's above that dotted line, you will be contacted when there is vaccine supply available for you to be vaccinated. If you fall below that line, uh, it's unlikely. I don't see a situation where all of a sudden there will be extra supply and they'll just start calling down the list. The governor has made clear that we cannot go below that dotted line until we have vaccinated everyone above the line.
And we are planning to use the fairgrounds as a site, but it is not currently a site for general public. As Jesse said, there's very specific categories. Occasionally people, especially at healthcare settings, may get a vaccine when they're not in those groups because they need to use up all the vaccines that they've allocated for that day. They can't re-refrigerate those. So there are some very isolated instances where some people that maybe are not in the categories get the vaccine just because they happen to be in the right place at the right time. But we still are working on that 70 plus. As Jesse mentioned, the state has diverted supplies that were already very, minimal to begin with. We were receiving about 3,000 vaccines a week. And the last couple of weeks, it's been dropped down to 800. So a number of the clinics have had to cancel their vaccination efforts. So we're trying to get on the same page with the state and make sure that our supplies, get at least back to that 3,000, if not more robust. Our capacity in the county is over 20,000 vaccines a week. So we have a lot more capacity. We're just not getting the vaccine.
So there was the question about the end of the night hospitals using up the vaccines. Is there a way to get on a list to be that person they contact at the end of the night if they need to use up a vaccine?
Again, I think there's overall notifications. I don't know that any of the providers are doing that. I'm not sure how they're figuring that out. But a lot of the vaccine comes in with a certain number of doses in each vial, so they have to use all those up. They can't sort of save one or two from the vial, so they do need to use them all up. And if people either cancel, that's usually when there's now an opening that they do need to fill.
And each of the providers has their own lists. Yeah. So that's where each of those providers are creating the lists of the 70 plus and some of these additional within their networks. Yeah.
And
I'm going to put the link I'm going to put in is the link I'm going to put into the chat is the Boulder County Public Health sign up for future, be notified when your group is up link. And that's because there was a request on that. This is just a notification system. It's not I want to place in line. It's just just to get more awareness and information. Okay, so I'm going to put that in right now. So I've heard, we heard, I think a lot of people are just confused because they see a course, Coors events or Coors Field, they have a mass vaccination trial. And there's a difference between having the capacity to giving the vaccines and, having the plans in place and having the vaccine. And that's the thing, is that we have the capacity, the abilities, the fairgrounds, the ability to give more vaccine. What's the limiting factor right now? And I see the governor release a press release every day saying the limiting factor right now is the amount of vaccine that's coming into our state and then being dispersed to the counties. So I think we just have to make sure we understand that we have locations, we have some of the capacity to be able to get it out. And we're building those systems. We just don't have the vaccine right now for some of it. Okay, so there's a question about 5-star. And this question is about the, Can you please speak to the restaurant and indoor event spacing requirement under 5-star? Is it 6 feet or 10 feet spacing required? And I think I got 3 calls about this today. The requirement, I think there's some confusion about that 10 feet between tables requirement. That 10 feet requirement is only if we're in red. So it's a 6 feet between table requirement, which is the same requirement that's in the order. The only reason there's the 10 feet indication in there is if we were to move to red, restaurants, that's the compromise, in order to stay open, because normally in red you would have to close indoor dining. In order to stay open, the tables would have to then be spaced to 10 feet. We are in orange, and when we operate this program and you're inspected for this program, you'll be inspected under the 6 feet, with the knowledge that if we ever move to red, in order to stay open, you'd have to then distance your tables to 10 feet, but that is only in a red requirement. Okay. All right, so I'm trying to get through these questions. So someone said that as a licensed massage therapist, they called Dora, and Dora recommended to call your insurance directly. And under healthcare with a direct person contact, and they were able to sign up, and insurance was fine with that. So I'm not sure, I think that call Dora, call your licensing, figure out, where you fall, because there's possibly a limited healthcare component to massage therapy. And then there's also the personal services component to massage therapy. I'm not sure if you want to add on to that, Jesse. I'm not sure. It's really a question.
Yeah, I mean, I would just say that again, our team is not involved in the question of who goes when with the vaccination schedule. We're really leaving that to the experts and those who are watching the numbers go by every day. So I think we want to stay out of that if we can.
So, yeah, I'm also getting questions like, how do I become an essential retailer and all that stuff. That's, again, not something that at that point, I think there's, there's lawyers, there's some other professional services that can help you figure out if you're designated an essential retailer as well, or essential business, if at this point you haven't already been designated. People are hearing of individuals signing up on multiple lists with multiple providers to see who calls first. Is this a recommended practice? Is there a downside to this?
Yeah, I think the concern is, as I mentioned, when they set up those vaccine clinics, they have a very set number of vaccines that they need to deliver. And then if you don't show up because you went to a different clinic, now that vaccine, they need to use it. So, and it's likely not going to the group that needs it, that 70 plus. So it isn't necessarily going to help for you to be on multiple lists and then not show up for clinics when you actually get called.
There's the question of which county do you sign up in? Do you sign up in the county you live or the county you work?
It does not matter. You can get vaccinated in any county as a Colorado resident. So.
Okay. Are there any other questions out there for Jesse on his last webinar? And Lane, who will continue with us? Lane will continue joining us every week. Again, we'll have these on Thursdays. Can't tell what day it is. Thursdays at 1 o'clock. Next Friday, I've already put in the chat the link to sign up for. And we have another question, but I'll finish my train of thought. I put in the link, link to sign up for next Friday's 5-star info session, so you can learn more about 5-star, applying for 5-star, the checklists, all of that. But please watch the website, the BOCO 5-star website, because as we get approved and we get all of our materials translated, and they become Boulder County materials and the application's done and all of that's ready, we will be putting them up on that website and we will be releasing the information. So can you review the 7, 10, and 14-day quarantine options?
Yep, happy to do so. And Lane, if I start to go stray off there, if you'll help. So the 14-day quarantine period is still the gold standard. We want people, if they are able to use the 14-day quarantine period, that is the safest, according to the CDC.
Can I stop you there?
Yep.
This is the number one question I get. Quarantine from what point? 2 days
yes.
prior to exposure? What is the point in which we quarantine from?
So you quarantine. I guess I'm not totally sure what you.
When do you need to have been exposed to the person?
Right. So if you were exposed to a person who tests positive up to 48 hours before they tested positive, then you need to quarantine. Is that what you were asking?
2 days prior to them getting their test results or 2 days prior to them taking their test?
Taking their test. So they tested positive on that day, even if they get the positive results 5 days later, they tested positive on that earlier day. So that's when you need to look forward to. Really good question. So 14 days complete, and quarantine is different from isolation. Isolation is if you have the virus. Quarantine is if you are a close contact. So 14 days, gold standard. 10 days is one of the new CDC options. The idea is that if you don't get tested, if you don't have any symptoms, if you're a close contact, you can do 10 days. Again, from that 48 hours before someone gets their, they test positive, you need to start your 10-day quarantine. You have to be symptom-free that entire time. And after 10 days with no testing, you can leave quarantine. If the 7-day option is you go into quarantine and after 5 days you get tested, and then at minimum 2 days after that test, and you have to have the results. So it has to be one of those tests that you get back pretty quickly. You can leave quarantine again if you have no symptoms and the test is negative. I think I confused myself. So, Lane, I don't know if you have any other.
Yeah, I think for the testing out, I still don't know that has been widely allowed in Colorado for all folks. I think it's for very specific situations where there's, I guess, adverse conditions to them staying for 14 full days. The only other exceptions I think to add are if you happen to be someone who has received both doses of vaccine, and there's still a few caveats to this, you don't have to quarantine if you were in an exposure. But there are some settings where you would, working in like congregate housing and in some of those other settings that are higher risk, may still need to quarantine.
Okay, let's say that while you're in quarantine, you've done the testing. You've done testing, you've done quarantine, you're doing the 10-day no symptom, but you've also tested and you tested negative. But during that time, you also came into contact with an additional positive person. You start your quarantine over again, don't you?
Yes, and you should have been quarantining. So what are you doing getting in contact with people?
Well, it's a roommate situation. So it was an additional roommate who was quarantining from another roommate.
Yeah.
And the two roommates, then one of them, they were testing, then one of them happened to test positive. And then this person, the second person, now has to go into quarantine again.
Yep.
Even though they tested negative prior to that, they're now in quarantine because they were in direct contact with the other person.
Yes, and again, I mean, this is a great opportunity to again say that testing is only as good as doing it as often as possible. Like it is not it doesn't say that you are free from the virus. It just tells you that you did not test positive on a specific day at a specific
All right, so we just confused everybody, but 14
Yay.
days, gold standard. If that becomes if there's some economic concerns, or there are these other CDC options, the testing out one is kind of hasn't been proven, but the 10-day is that other option, 10-day no symptoms.
Yeah, I think to sort of follow on what Lane said, the 7-day is really a very specific case. We're looking at people who are working in settings that maybe they can be safely back at work without interacting with other people, or there's a crunch on the number of people who can work, and so we need that person to be working. That's where the 7-day comes in. But yes, absolutely, the 10-day is no testing, no symptoms, 10 days.
And I've had, between me and all my family members, we've gotten COVID tests quite a few times. I haven't had my test results back in 2 days yet. It's
No.
been normally 72 hours to 4 days. So normally you'll end up being in for 9 days, 8 or 9 days. So any more questions out there? We're at 1:41. And okay, this is that last call. So I think we've had a lot of big thanks to you, Jesse. Big thanks. You've had a lot of stamina sticking by. For a while there, we were doing 8 of these a week, 1 per industry, and
Yes,
you were on
it
a
was
lot of
rough.
them. And then we moved to 2 or 3 a week, and now we're at 1 or possibly 2 a week. So thank you for sticking by with us. And
Thank
we
you.
look forward to continue to work with you in the public health realm, but just not on these webinars. So thank you.
Absolutely.
And we will see everybody next week.
Thanks, everybody. Thanks, Corinne and Lane.
Thank you.
Bye.